myself and Raffaella will introduce this special pre-conference. I will talk about the rationale, the justification why this new joint action, and Raffaella will present who is and the organization of this new activity. So why, what, and how? In front of these divides, Europe has made a lot of investments, and at the beginning of the 2000s, it was mostly about measuring, understanding, analyzing. In the 2010, it moved to more policies, actions, to a commitment to something of more concrete for making progress in the policy response.
My name is Raffaella Bucciardini, and I work at l'Istituto Superiore di Sanità, the Italian National Health Institute. And I am so happy to see that so many people are here today, and I do hope that will be interesting for everybody.
What is my spirit in endorsing and supporting this project? That when Professor Costa and Dr. Bucciardini came to me and say, would the Istituto Superiore di Sanità, the Italian National Institute of Health, propose for the coordination of this project, I really thought that was a great idea. And the fact that this project was launched in Luxembourg on June the 28th with Commissioner Andriukaitis, with Professor Michael Marmot and other colleagues, I think that really, even though we are living difficult times, this can be our finest hours. So, difficult times. The darkest hours, maybe. I think, these are the darkest hours. As the Prime Minister Winston Churchill showed, sometimes you have to stand up, even if you are isolated, in the name of freedom. And if you fight the right battle, you can really be happy and to spend your time, even in time of troubles, thinking back that they have been the finest hours. You may be wondering that I am exaggerating in saying that we are living in times of war. Over the last 8 years, the world has witnessed the worst financial crisis since 1928, a global recession, an unprecedented Eurozone sovereign debt crisis, the outbreak of war in the Middle East and North Africa, the civil war in Syria, a major migration crisis in Europe, the war between Russia and Ukraine, the Brexit, the surge of cyber terrorism, which has strongly influenced the US election, as the court is now showing, the nuclear tensions in North Korea, the so-called secessions in Catalonia, the first populist government in a founding member of EU, unfortunately, in my country, and the trade war between the USA and the world. I can tell you that none of the two World War II were preceded by events that were most concentrating and dangerous than this. So what does this mean for health and healthcare? This is the mini Italian family in the 70s when the National Health Service in Italy was created. You know, 2 children, 2 parents, 3 grandparents. This is the Italian family nowadays. 1 child, 2 parents, 4 grandparents, 2 grandparents. I mean, you don't need to be an economist to understand that this is not sustainable. You know, who is going to pay for the people that are up on the pyramid? And by the way, they are sick. They are having a lot of chronic disease is increasing like this, and the chronic conditions are already costing our countries an incredible amount of money. We are there. We are there. When children are separated and put in prisons, and when inequalities are increasing, we are there to fight this battle. And I strongly believe that if we fight this battle, we will remember these years as the best years of our life. Thank you very much for your attention, and enjoy your work.
So I work for the UK Health Forum. That's a not-for-profit organisation. We work closely with the Department of Health and the Public Health England in the UK, so we're well aware of the engagement that you need to make and what is possible within a government context. The Health Equity Pilot Project, that focused on behaviours, so I was particularly pleased to hear, although it may sound strange, the previous presentation which took things up to a much higher level. So I think we need to be careful not to forget that highest level and then come down to the wider determinants, the environment and education and so on. Equity Action and the joint action JAHEE is the current project that I'm working on, which is a pilot project, which is strangely enough funded from the European Parliament as a pilot project, and it's focusing on socioeconomic status differences, so a gradient approach particularly on behaviours, and you can see it focused on nutrition, physical activity and alcohol consumption. We were a consortium, and just to give you a very brief picture of who was involved, because I think it's important to know some of the messengers.
I'm very briefly going to tell you the outlines of Work Package 5 and how we are thinking of dealing with this challenge, and leave room for some questions afterwards. So, one might start with the question of why monitoring after all. Well, as already has been said or indicated, since health inequalities is much about health inequalities between countries evolved from inequalities in the distribution of social health determinants within countries. It would be necessary to actually monitor the evolution of how these social determinants are distributed over time within countries to understand what's happening in Europe today. It has been very well put by Michael Marmot, saying that no data, no problem, no actions. 12 countries, and most of them were in Stockholm last week to discuss how to start.
Work Package 6, Healthy Living Environments, has, as the other work packages, the same structure. We are now in the first phase of drafting the policy framework for action. Afterwards, in the beginning of next year, we're going to have the country assessments, and then the main thing starts in spring and summer with the implementation of actions. Afterwards, lessons learned, policy recommendations. So that's the same structure for Work Package 6.
I'm Mirjam Weber. I'm working at the local government, the city of Utrecht, which is located exactly in the middle of the Netherlands. And I'm one of the Dutch members in this joint action, as the Dutch Ministry of Public Health is participating in several work packages. In the Netherlands, the largest cities are obliged to do a public health monitor every 4 years. So via field surveys, collect health data and many more data. In Utrecht we do so every 2 years, and we have a specific website even for it, where you can find all the data, all the databases and references in a very broad sense. So it's not only health data, but it's data about physical environments, on work and income, and everything you would like to find.
It's time to begin to look at upstream initiatives, which are harder. The upstream initiatives are really looking at data and research. And it's not just data, even though I'm an epidemiologist and I love my numbers and I think we need the numbers, but we have to go beyond the numbers. We have to look at what is behind the numbers, really, to find out what should be done. Then comes the most difficult of all, and that's what I'm so envious of, the healthy living conditions and what Miriam presented, where you really can get leadership from decision makers, because unless you have that, you have no chance. We can have all the numbers we want, we will not succeed.
My name, as I said before, is Daniel Lopez Acuña, and I am adjunct professor of the Andalusian School of Public Health in Spain. And Spain has the responsibility within this joint action of coordinating this particular stream of work that has to do with improving access, very specifically improving access to healthcare and related social services for those left behind, is to contribute to the goal of leaving no one behind in terms of access to health services and related social services. So this is the fundamental objective of this stream.
Health inequality has been a central issue in Finnish healthy public policy for more than 30 years.